Joining us to discuss, Chris Meekins, Raymond James healthcare policy analyst. Very good afternoon to you, Chris. Thanks for joining us. What's your key takeaway, the key headline from what was announced today?
I think the key headline to me is that the administration wants to do something that will be very popular with the public. When I need to get new tires for my pickup truck, I can go into a tire shop and know exactly how much it's going to cost. When I need to potentially get an elective surgery done, I have no way of knowing what the potential costs would be and what my out-of-pocket costs are. So what they're attempting to do is really bring some transparency to the healthcare system, and I think that is a very laudable goal. What worries me, though, is that Congress may not have given the administration authority to go this far. And so what we have seen is this administration has repeatedly attempted to do things that they believe are very popular with the public, but then the courts say you don't have the authority to do that. And I think that's why, if you look at hospital stocks and insurance stocks today, they went up in addition to other issues related to Elizabeth Warren.
Yeah, Chris, that was exactly the question I was just about to ask you. Anthem, Humana, Centene, United Health, they're all up 5% right now, which seems like a pretty sizable move for these names. How much of this is tied to the unlikelihood that this actually gets fulfilled by the Trump administration versus what's going on with Elizabeth Warren's campaign and Medicare for All right now?
Yeah, I think that's a great question. And what I believe, looking at the numbers and in conversations I've had with investors throughout Europe this week, though I'm normally based in D.C., is that people really don't view the transparency initiatives as something they need to worry about. Because if you look at this administration, they tried to take action to require pharmaceutical ads to have prices in them. The courts said that went too far. They tried to make site-neutral payments for hospitals. The court said that went too far. So the administration has proposed a lot of things, but investors are kind of at a position where they're like, until something actually gets implemented and the courts say it's okay, we're largely speaking going to ignore what the administration is proposing, which is why the big news today really was what Elizabeth Warren did. And she basically completely backtracked from her Medicare for All only position. She said instead of a bill has to have Medicare for all in it, if she were to be elected president, now she's saying she'd take a two-step process, pass maybe a public option, which insurers are not worried about, and then maybe in year 3 of her presidency, she'd get to Medicare for all. So these names, which have really been held back because of the perceived threat of Medicare for all from Elizabeth Warren, are now off to the races and could continue that for the next weeks.